This is a Doctor's Day special video that I'm gonna be posting many days after the actual Doctor's Day. What a logic! Hey Flix, how are you all? I hope you guys are doing well. So as you guys can see by the title above that it's an interesting video where I'm gonna be talking about what makes a good doctor according to me. So I know it's an interesting as well as controversial topic, and these are my take on that, and I hope you guys all can also agree with that. And if you have any more points, you can comment down below and suggest me those points so I can be better in my career also. So without further ado, let's see what are the main things that make a good doctor. Now, disclaimer that I don't mean to say if you don't have an excellence in these kind of skills, that means you make a bad, evil doctor. Don't take it that way. But these things, according to me, they have worked for me personally. So the first point is that communication skills. Okay, so let me elaborate on that. As a doctor, we have to talk to many patients, their families, their relatives on a daily basis, like numerous patients, and they are from different cultures, different backgrounds, their education level, their occupation, everything is different. So we have to be good in communication so that we can communicate with every kind of people, okay, like without any gender bias or without any age difference, like from बच्चों से बूढ़े तक हम easy language में we can talk to them and we can make them understand that what is wrong with their humanly body or why are they in pain. And mostly the one thing that works for me, that it gives patients utmost satisfaction and relief when a doctor assures them that please take these medicines, or after following these kind of steps, at least after some months you are gonna be feeling less amount of pain in your body or the discomfort that you have come here to seek help from. So you need to talk to patients. I know that sometimes when there are too many patients, that sometimes can be too much overwhelming, but as before being a doctor, all of we were a patient one time or another. We know that if the doctor doesn't explain to us that what has happened to our so lovely body, that makes us even more anxious. And so you have to be good in communication with the patients, so that can make them familiar with you, they can be comfortable with you, and with their history taking and their talking, you can even see many clinical features which they couldn't even tell themselves to you. Okay, now moving on to the second point, that is emotional intelligence. Okay, and what I mean by that is there should be a balanced emotional output from the doctor's side. Now what I mean by that even, that is there is a difference between empathy and sympathy. Sympathy means you are feeling bad for that person, but you are not doing anything for that person. But doctors need to have empathy, not only sympathy. They need to have empathy. And what does empathy mean? Empathy means feeling mildly bad for that patient, but mostly being active to relieve the patient from the pain. Okay, because that's what we are here to do, that's what they want us to work on. Okay, so don't be too over emotional in the sorrow of the patient, or don't be too harsh or too rough on their side, because you have to deliver the proper amount of emotion so that they don't panic. Okay, because you know, when a patient comes to you at hospital or at your clinic, they are already afraid that what is going on inside their body. Their relatives are very in agony, so you need to talk in calm voice and you need to calm them down. But it's not that you will like reassure them as much that your patient is totally fine when he is not. I'm not telling you that, but you need to make them understand the complications or the risks about that disease, but in a healthy way, in a calm way, so that the patients will be at least in a little bit less scared. Now the third point is teamwork, and I know here that it must be sounding very crazy, that because whenever you guys think of or visualize a doctor, you see a nice clinic, a chamber where you are prescribing medicines singularly, but that is not the case always. When you work in a hospital or in a corporate world, when a trauma case comes in, I mean emergency medicine or emergency surgery, there has a full team where you have to work as a captain of the team. Okay, you have to work properly with the sisters, with the group D staffs, with the health workers and everyone, because when a patient is in danger, you can't do everything all by yourself, so you need to trust and rely on other people who are also excellent in their skills to be your eyes, ears and nose. Okay, like someone will measure the BP, your juniors, maybe sisters will hand over the instruments for the stitching and things like that. Okay, so you have to also maintain a good collaboration and a healthy atmosphere with your not only with your co-workers but also with the other health staffs. Okay, this is like a family. And the fourth point is, so now the fourth point is, that is discipline or organized work. Okay, that's why I want to say, like, we have an image of a doctor, a proper doctor. Okay, and I know this would sound a little bit cliche, but that's how it works. So it means that whenever you go to your work, to your clinic or hospital, you need to look clean and well behaved and well mannered, so that patients psychologically accept you, so that they can trust you in telling their problems, whatever they are facing, their health issue. I mean, like, some people think, and we have done it also in internship, but over time we understood that that's not the proper way to deal. Some people go to the hospital in a rush without their with their hair messy, their clothes all tangled and like that. You don't even know that they are even a doctor. So how can a patient trust that person who can't even take care of themselves before coming to the hospital? How can a patient or the relatives of the patient can trust them with the health of their loved ones? Okay, so you need to understand it. You need to appear properly, and everyone knows by the time that after being adult, the appearance matters. And we are not saying कि सती सावित्री बन के जाओ या फिर सूट बूट पहन के जाओ. It's not like that. You have to be presentable. That's all I am saying. And maintain a professionalism within your co-workers, and that's also that will also help you to maintain your emotional internal calms, because you need to organize your thoughts also. In the initial days of our internship, when we saw some grievously hurt patients or when people died, it was very hard for the junior doctors like us to handle. Me and many other, most of the doctors, sometimes or other, they became emotional, because like we have been treating that patient, taking care of the patient day and night for 2-3 days, and when he couldn't survive, like, that's very heartbreaking for us. But you need to take care and be hold of that emotions within yourself, because you can't show that to the relatives or anyone, because that's ultimately your workplace and you are supposed to be the strong pillar there. Okay, and the last point, that is the fifth point, that is proper message delivery. Okay, and what I mean by that is that a huge part in our medical practice comes with delivering the bad news or the complications of a disease or the result reports, explaining to the patient parties. Okay, and if when a loved one dies, or there is no cure for a cancer patient, or a patient is in great pain but no medicine can reduce that much, and you have to deliver that news to their loved ones, that becomes very tough. And you need to learn, and even you need to practice it in front of the mirror in your home if you are not good at that, to stay steady and deliver the message. It has to be a perfect balance between emotional response and a calmness. Okay, you can't be too rough or rude or blunt in saying that those results, because those are huge to take for that samne wala insan. And you can't also be too emotional, because that will make the patients too emotional also. Okay, that's why you need to stay put together, so that they can understand the disease or the information properly, they can take that properly. And those are the main 5 qualities that, according to me, will help any doctor to go very far in this field. And let me know if you agree with that, or I guess this information will help my juniors and the brooding doctors to be a better clinician on their internship days, because these are the things that I have learned with my mistakes and my experiences. And happy Doctors Day to all of my juniors and fellow doctors and seniors, and the people who have the burning desire to being a medico. Happy Doctors Day to all of you, and may you heal your own pain and relieve your patients from their pain also. And stay happy. God bless you. Bye.